Dear viewers, subscribers, budding nursing and paramedical professionals, Assalamu alaikum warahmatullah. Welcome back to your own channel, Advanced Nursing Theory and Practice. Today we are again going to discuss the subject of nursing foundation with the topic of Code of Ethics proposed by American Nurses Association. As we have already started the series of Code of Ethics and we have gone through ethics, terminology of used in ethics, and code of ethics that has been proposed by internationally recognized body of nurses, that is International Council of Nurses. And this video series is having many parts, and this will be part second of code of ethics series. So we must know that American Nurses Association developed code of ethics in the year 1950 and revised it from time to time. The latest revisions were actually in 2000, then 2001, and in the year 2015 the latest revision was made in it. In year 2015 it was declared as the year of ethics by American Nurses Association. So actually American Nurses Association has put forth various provisions that must be fulfilled by a nurse so that to guide themselves by a code and maintain ethics so that to prevent any legal complications arising from it. So provision first was there, that is the nurse has to maintain a professional relationship and has to practice with compassion. Number next was that she or he has to respect the human dignity, worth and uniqueness of each and every individual. We can say that nursing professionals has to look for the individual differences, as we read in the psychology, as the outlook of disease, or the we can say outlook of patient towards disease may be different, even if more than one patient might be having similar disease. So some may take it in a positive way, and some may take it in negative way. The emotions of one person may be aggravated and others may be realistic. So we have to respect that uniqueness of individual or their way of looking towards the disease. Then nurse has to provide care irrespective of social or economic status or personal attributes or nature of health problems. This means that we don't have to look about the status and role of a person while providing care. We should provide care similarly to a person from the higher strata of the society and to the lower strata of the society. In practice, it might seem difficult, but we have to maintain it anyhow. Then our primary commitment, that is the primary commitment of nursing professional, is the client itself. This client may be family, may be individual, may be group of individuals, or may be community as whole. Thus nurse has to focus on his or her client and provide care related to the problems faced by the client. Number next we have to uh, think about is that nurse has to promote health, nurse has to protect health, nurse has to advocate for the health of a patient or group of patients or family or community, and she or he has to strive hard in order to protect that health by means that are available to him or her. Then we must know that nurses are responsible for individual nursing practice. This means that they are responsible for the activities they perform and they are accountable for those actions. So when we say accountability, so whatever action they perform, they are accountable for that. That is simply we mean that nursing professionals are answerable to their higher ups regarding actions they take for patient while caring or dealing with them, or even if a nurse is delegating some responsibility to a junior, or we can say a newly appointed staff, or we can say an intern. So delegation of tasks should be done so that there will be no compromise on optimal health care of the client. This will preserve the accountability part of code. Then next is the nurses owe same duties to self as others, that they have to maintain and establish therapeutic relationship and interpersonal relationship at the same time. With the patients they have to maintain therapeutic relationship, and with the colleagues or co-workers or healthcare team members they have to maintain interpersonal relationship. Then they have the responsibility to preserve integrity and safety of the self and of the profession. They have to maintain the competence, they must be skilled so that they can provide care with efficient manner, and they should make provision, or they should strive for continuing their personal and professional development and growth by being actively involved in various programs like continuing nursing education programs, seminars, article writing, then guiding the students for research activities, or being acting as a preceptor in case of students coming to their areas for clinical practice. Then next is the nurse has to participate in establishing, maintaining, improving healthcare environment and conditions of employment conducive to the provision of quality healthcare and consistent with the values of the profession through individual and collective action. Thus, we can say that nurses have to take each and every step that will preserve the environment that will be healthy for patients, co-workers, healthcare team members, and students whosoever come there. These employment conditions should be stress-free. The co-worker should work in an amicable and cool and calm environment. There should be no conflicts, no frustrations regarding goal achievement. Then next is that nursing professionals have to participate in advancement of profession. By this we mean that they have to actively involve themselves in the practice. They have to get involved in the education side, administration side, and they must be knowledgeable about it, and they have to contribute in the forum of research, or they can conduct case studies or report findings, or report analysis or meta analysis they can do while being in the clinical settings. So this way they can help in boosting their own personal growth as well as professional development can be achieved. Then we can say the next code of ethics, or the provision in the code of ethics by American Nurses Association, is that nursing professionals have to collaborate with other healthcare team members and the public in promoting community, national and international efforts to meet the healthcare needs of the client, whosoever maybe the client is already discussed. So it is responsibility of a nurse to maintain that relationship. Thus here we can simply say that intersectoral coordination is of utmost importance. So next provision under code of ethics as proposed by American Nurses Association is that nursing professionals has to be represented by associations, and they have to get involved in them so that their voice can be heard, so they can put forth their values, their knowledge, their findings to the public, and they can shape and reshape social policies or political policies or government policies regarding profession of nursing. So these were some of the provisions that has been laid down by American Nurses Association in 2015 for Code of Ethics for nurses. Thank you for being with us. Do not forget to share, subscribe, and support your channel. Your suggestions and valuable comments are welcome at these emails, and you can comment in the comment box for any improvement and needful and other things. Thank you very much.